Assalamu alaikum wa rahmatullahi ta'ala barakatuh. Viewers of Gunjur TV Online, welcome to another episode of Impending Health Crisis, a result of COVID-19 pandemic. Today, my guest is Dr. Yankuba Sanneh and also Ms. Binta Bojang, a nurse based in the UK. And it's going to be an 1 hour program, but it's something you're going to enjoy. Yankuba is already here. Yankuba angalelo mitide. As they say in Suguda. Go angalelo mitide. Binta. Miyandron. So what are we going to do? You're going to introduce yourself. Then I will give some statistic about COVID-19 and especially in the combos. So the numbers I gave, if I think what is happening in the Gambia, they are only testing not only the sick, but the very sick. Because last week today, their death rate was 1.8 and positivity rate was like 37%. And it went to 40, but it stays at around 37%. But today, the positivity rate is 48%. And the number of tests also is going down. That means the healthcare facility is struggling. So just to give you the worldwide total quickly, and then how it is in Brufut, Suguta, and Brikama. So far to date, since COVID-19 arrived in December 2019, we have 21,204. 204,005 people got infected, and out of that, 759,765 dead. And we have 14,026,886 recoveries. And currently, number of people with COVID-19, active COVID-19, stands at 6,352,795. And those critically ill with COVID-19 across the world stands at 64,549. So the numbers for recorded past 24 hours across the world is 145,855, and number of death 3,000. So normally what I do, even when Gambia numbers were down, I keep mentioning these numbers because as long as those numbers exist, Gambia is not out of the wood, and exactly that what happened. But unfortunately, the people who matters, that's our healthcare managers on the ground, are not taking notes of that. Ivory Coast past 24 hours registered 42. They are definitely on the other side, the good side of the curve now. But Senegal still numbers start going up. They steady, but they are going up. Senegal recorded 132 new numbers. Guinea-Conakry 32. Guinea-Conakry 82, and Mauritania 31 new cases. Mali 15 new cases. Bissau 15. And Gambia 67 new cases and 7 new dead. And Sierra Leone recorded 7 new cases, and Burkina 15. So all these numbers are coming down. But coming to our hometown, Brufut so far recorded 12 cases. Sukuta Salaji 2, Sukuta Sate Bakono 22 so far, and Brikama around that world, Brikama 65. Sorry, I need to. Yeah, Brikama 65, Yundumu 7, Willingara 2, Jabang 4, Brusubi 26, which is Brufut anyway. So Brufut, if you put the two numbers together, is 38. So yeah, Brusubi is Brufut. So I'll call it. It takes the good out of it. Yeah. So these are Banjul 147. So if every COVID-19 patient is capable of transmitting into 3.58%, 58 people. That's, you multiply these numbers, it's terrible. So basically, Binta, I'll let you introduce yourself, then we continue. Yankuba draws, but I hope I believe you'll come back. Who, Jamalum Bintati, to our
Okay,
viewers.
Hamid, thank you so much for having me. My name is Binta Bojang. I'm originally from Combo, Burfoot. I'm currently living in the US. I have been in the healthcare field for around 20 years or a little over 20 years. I am currently practicing as a family nurse practitioner and also psychiatric mental health nurse practitioner. So I am not in the hospitals per se dealing with these severe cases of coronavirus or COVID-19. However, I am, I see a whole lot of patients. I am involved in with screening the patients to see whether they have COVID-19, and then so far I've been seeing a very, very interesting cases of COVID-19. They are not severely ill, but the presentation is keep on changing, and then some of them are very, very impressive.
Yeah, thank you very much, Binta. That point you mentioned, you have to elaborate on that. You said numbers are changing, and the numbers you are seeing, the cases you are saying are very
Mhm.
impressive and changing. Can you elaborate on that,
Well,
please?
initially, when COVID-19 started, the symptoms that we usually educate the people, and also what I'm seeing in the Gambia is telling people, if you have symptoms of like sneezing,
Yeah.
coughing, shortness of breath, then you
Mm,
need to go to the hospital because and fever or headache. Those are the most likely symptoms of COVID-19. However,
mm,
recently I have been seeing a lot of people with nausea, vomiting, and
mm,
diarrhea. And if I
mm,
screen them for COVID-19, and they will come back
mm,
positive. I mean, in few cases, I have even seen people with a rash and fever from nowhere. And then if
mm.
I offer them this to screen them for COVID-19, they agreed, and sometimes it will come back positive. So that's what makes it different from what we are educating the public about.
Okay, sorry, you mentioned one symptom here,
Hmm.
which is very, very common with malaria, nausea and vomiting. What do you think are the implications for that now that we are in the height of malaria season in the Gambia?
Well, I think in the Gambia, I think people needs to be very, very careful in screening these patients. I know you have mentioned the numbers, and for me, my assumption is that the numbers are way, way more than what is being
Mm,
reported in the Gambia.
reported, yeah.
Um, and then now that we have COVID-19 and we are in the rainy season where malaria is very, very rampant, as healthcare workers, we just need to be very, very vigilant in not only screening the patients for COVID. We also have to pay attention to the malaria. For example, um, when people come to my clinic for sore throat, they say they have sore throat. Or when we were in the flu season, when they come, they say they will come with body generalized body aches, fever, um 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 even mild cough. I usually screen them for flu before I'll go to COVID-19. COVID-19 is usually, or screen them for COVID is usually my last to go. Again, now that the flu season has passed, when they come in with sore throat or mild fever, especially when they are younger, I usually screen them for strep first to see whether they have any strep throat. If that is
Mm,
negative, then I will send strep culture, and also send how to call it, and also send COVID. I just
mm.
don't base everything on COVID. So that's why I said the healthcare workers in the Gambia, they just have to be, they just have to broaden their screening system.
Yeah, thank you very much. First, Dr. Yankuba Sanneh, introduce yourself to the viewers of Gunjur TV online. Then I will put these points Binta just mentioned about the new kind of symptoms they are seeing. Can you hear me, Yakuba?
I can hear you loud and clear, but I'm guessing you can see me and you can hear me.
Yeah, I can see you and you can see you clearly.
Thank you so much, Mr. Manchon. Yankuba Sanneh. Gunjun ko jama ba ilonne.
Bunjurun kolda mamal darai watch can. Entire
Because nyalo
Gambia is
kunda koto
watching.
nilinka jete of Yankuba Sanneh. From
Mm.
Sukuta, actually, I have worked here for some time. But nga joko started no RVH many years ago, 2001, what Gambia no. And I've worked in the UK since then. I think that's enough introduction. Thank you.
Yeah, yeah. Thank you very much. You heard Binta. He said in his clinic, in our clinic now, recently, it's like COVID symptoms are shifting. They seen more people with vomiting and nausea and also diarrhea, which are also common, with malaria. And now that in the Gambia settings, we're supposed to be in the malaria season. So, what do you think? The doctors or the nurses in the Gambia need to do to make sure that they don't miss COVID or they don't miss malaria or miss both of them?
This is a very interesting question. And it's really nice because if I
Mm.
address, I have
Mhm.
always imagined or been thinking Gambian will say how we treat other diseases because with all the
Mhm.
stigma on COVID, from
Yeah.
Wolfanka Hanya Kata Hospital ba.
No,
Before COVID,
I can tell you that's very very common.
yeah.
It's a in fact I have to be honest with the family. My mom was a little bit ill last week. They asked the boy nobody to inform me because I will insist he goes to the hospital.
No.
So that's
So,
how serious the situation is.
yeah, and it's very worrying. Before COVID, there were
Hmm.
diseases, and
Yeah.
there are diseases that are highly treatable. And
Hmm.
as Binta was trying to explain, lots of
Hmm.
diseases have symptoms that cross over with COVID.
Yeah.
So we should have a high index of suspicion for COVID, obviously, but other
Hmm.
diseases need our attention as well.
Hmm.
So imagine diabetes in the Gambia, imagine the
Hmm.
other chronic illnesses, our
Hmm.
tuberculosis, are they getting the
Hmm.
attention they deserve because of
Yeah.
COVID? Our health authorities, have they actually made room for control of all these chronic diseases that are as
Hmm.
likely to kill as COVID? That question is really important. I don't know if we have
Hmm.
put those across. So whether now all attention has shifted to COVID and no one is
Hmm.
paying attention to our diabetes, our chronic hypertension, our renal failure, our simple infectious diseases we can treat, including all this, even sore throat and cancrum oris and malnutrition, for whether they are getting the due attention they need is a question that begs answers. And the only thing I want to ask, I don't know if this is happening there. It could, I don't know if you know the answer, Mr. Manja. Do they
Yeah. Go
have a
ahead.
particular triage at the point of entry into the health system, like in the emergency department?
Hmm.
When patients come, are they
Hmm.
triaged into those that are higher into cohorts where people with
Hmm.
suspicious COVID symptoms or who are likely COVID go into one stream, and then every other
Hmm.
person go to other streams. This includes trauma, the simple minor injuries,
Hmm.
and other illnesses that obviously have telltale signs of things that are known COVID. I want to know if that
Hmm.
is happening. I don't know if you have answers.
No, definitely I don't know, but I will be surprised if that is. To be honest with you, the information coming from the ground is complete chaos. To be honest with you, because the last guy I heard from was a 29-year-old. This was 2 days ago. He was actually tested positive. Now, in fact, if you are tested positive, they don't actually admit you because they don't have place if you are not very sick. So they ask this guy to go home and do X, Y, and Z. If he feel ill, he can call them back. He went back. His condition started deteriorating, and he started calling the 1025. Nobody responded. I think that number is seriously undermanned. So eventually he was so worried he called Fatu Network.
Mm.
Fatu Network, and he left his number with them that he's getting his situation is getting worse. So Fatu Network have to make a Facebook post and also they try to contact this 1025, they couldn't. So much more you the organization you are talking about at the health post. And MRC, which you know MRC, you work there, they are well established, they have structures, but they have to close, their OPD to the general public because they are overwhelmed. Much more um, um, RVT, Edward Francis Small Teaching Hospital. I don't know why they named that. It's too long for me. I, I keep forgetting. Binta,
Yes.
Binta, Yankuba mentioned something very, very important here. Gambia, we have lot of chronic illnesses like diabetes, hypertension, malnutrition. You can name them. And now
Mhm.
malaria. We are in the malaria seasons. And now everything is about COVID. So what do you think, our healthcare do you need to do to make sure that those suffering from those debilitating conditions are not being neglected or ignored completely?
Well, to me, COVID in the Gambia is a very, very concerning. Um, Due to so many factors. That's when it started, like in I think this was in March. I made a video, and I made a video. I mean, I chose to make the video in Mandinka because to me,
Yeah.
that's how it's going to reach more people. Not
Mm,
that many cannot speak English, they can,
mm,
but
mm,
sometimes it's better if they hear it in their own languages.
mm,
Is
mm.
it resonates with them better. And it's unfortunately I cannot speak Wolof. I cannot speak any other dialect, but I also mentioned it in my video that whoever can speak in any other language that you are comfortable with, you can translate the message that way, or you can also make the video in that particular dialect or language, so it can reach more people. So the COVID in the Gambia, like I mentioned before, is concerning to me because I mean, I'm not living in the Gambia now. I'm just hearing by, I'm just going by what they are saying on the ground. To me, it's very, very dysfunctional, and then they are dysfunctional. I mean, it's being managed by dysfunctional executives, and then I think that that's going to make things worse for the country. I am scared. I feel like there is a bubble, like a bigger bubble going on in the Gambia, which when it bursts is going to be very, very bad for everyone in the country. Um, how I mean how how things should be arranged in in the various clinics, because I Dr. Sanneh mentioned the ER, and I think the only ER that we have in the Gambia, to my knowledge, is Banjul. I don't know about
Mm.
Serekunda, but let's talk about Sukuta. Let's talk about Sukuta. Does Sukuta have ER? Sukuta just have a clinic. Let's talk about Burfoot. Burfoot just have a clinic, and all these rural areas, they have clinics. So those clinics, I don't know what arrangements, like I told you guys before in our first video, Burfoot, they put a notice there to say that they are not accepting patients. And I'm hearing right now that even if you go to the clinic, you are coughing, everybody is running away from you. So all the nurses, to my knowledge, in at Burfoot Clinic, they are currently out because they are COVID positive. I don't know how come, even though they are exposed to it, but to me, are they protecting themselves? I think we just have to start with the healthcare team, um, in order to come with a strategy to 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 see how we can triage these patients, because it to me it seems like the healthcare team or the healthcare personnel are not properly they are not even properly trained how to take care of this situation, and which is not good for them, and it's not also good for the society.
Okay, thank you very much. Yakuba, the tracing you mentioned, and as far as I know also, the testing Gambia is doing is still PCR, which takes like almost a week, 5 days. Even MRC, it takes like 5 days to get your results. So do you think we have a facility to mix and wait for those results before you start separating them? Or what do you think? How do you think they can go about this in that kind of situation? Because we don't have a rapid test right now in the Gambia.
I don't know if I should go and garnish a little bit Binta for now, or go straight to your question.
Yeah. Go. So
Binta
you can
was a very important point coming. What
Mhm.
I tried to say to start with, put
Mhm.
the more cohort into people as suspicious COVID and other people that are not COVID,
Mhm.
so that at that point where they are being triaged, the person there will have the full PPE protection. But subsequently, all the other people on the different arms, if you are confirmed COVID or suspected COVID, you'll be dealt with by people. They are all COVID PPE. They are all COVID PPE
Dress.
wearers or users, and all the others on the other side will have all the common or what you will do for any patient, like just a surgical mask. In a way, this will save our PPEs that are really expensive. So we have people, a cohort of people that are suspicious COVID, who will be treated by people who have full PPE, and all the other people are treated with just a precaution or caution you would do seeing other patients in this endemic. And that way, we will have all the people treated with due safety, and everybody will be treated in a place where the resources will be used in tandem with how well or unwell they are. And as we said, our health workers who are looking after these people, as you are exposed to COVID or suspected COVID, you know how to look after yourself. If you are less of a risk, you know how to look after yourself. And the hospital or the healthcare facility is a divide now in a way where people with high risk will be on one side, people with low risk, including staff, are on the other side. And resources will be allocated accordingly. In that way, not everybody will be in COVID PPE, which are expensive, obviously. And acquisition at this point will have a problem with it more than anything. Coming to your question, Sai Amo. So the test, obviously, is an international problem. All the people doing PCR, obviously, with the delay that is associated with it, and all the others doing all the fastest. I'm so Saudi Arabia and Dubai are leading in those areas. People having tests now that will give you a result in 90 minutes, which clearly is great. But how do you do a test and you have to wait 4 days for a result? It's not only fraud or fraudulent. Your test could be you are waiting for your result. Your results come out in 5 days. It says you are negative. But between the time you've taken your test and the time your result come out, have you been exposed? Could you have been positive from there or from the very day you took your test? So the delay in the result doesn't help at all. If as a country we can adopt those ones that will give you a result quicker, it's much better for us. Because you are not going to test somebody today and tomorrow he is involved in high risk or he has COVID contact. By the time the result come out, he's really positive, but according to the test, he's going to be negative. I think that answers that question. Former answer.
And Salafi Tambita. Thank you very much. That was a very good answer from a microbiologist point of view, because it takes seconds to be infected with COVID. And we know now COVID is at Edward Small Francis Teaching Hospital, whatever you call it. We know COVID is there. And Yakubu, when facilities are infected, they need to evacuate it and fumigate it, might be closed for 48 hours. But here, this is our only referral hospital. That's not possible. So that's make it all the more challenging. I heard they start using Andemban Clinic, which is also thanks to corruption. It was never finished because staff offered to do part of the renovation and he left the rest for the government. But unfortunately, the government didn't do their side. So now, Binta, you said there is a bubble in the Gambia, which is just a matter of time before it bursts. So how do you think we can minimize that bubble when it bursts, the implications? What can you tell Gambian what they need to do from individual to government level?
Ahmed, before I
You
go
can
further,
speak
but
in Mandinka, any
yeah,
language you feel
yeah,
comfortable.
let me talk a
Mm,
little bit about what Dr. Sanneh info about the rapid testing and the PCR.
mm,
Hanin Tolufong Lajang, we use
yeah,
PCR. We started
yeah.
with the rapid testing, but
Mm,
I mean, it's giving
mm.
us a whole lot of false positive and results or false negative results. The sensitivity is like 50%, I think. We have tried a couple of products, but due to the low sensitivity, wala na nga stop. So, but the PCR is even though is like it takes longer. The sensitivity for PCR is high. I think it's like around 90% or so. If I don't know. You guys could maybe you guys know that better than me, but I know the
Yeah,
PCR is
PCR is very close to 98% specific and also reproducibility, because that is very important. Like
yeah.
if yeah, that's the nice thing about PCR. But Gambia, the other challenge they have, they will
Hmm.
do a PCR, say the last minute the current will go off. That means you have to repeat everything.
Oh
Last time
wow.
I checked, they were in their minutes they were talking about securing UPS to avoid that and all that. So everything is chaos. Sorry to interject there, but you
Okay.
can continue. Yeah.
Okay. So kwe mingi nka olum the me talking about the bubble like mimbe Gambia
Mm,
I mina na insula or what people should do to prevent themselves.
mm,
Coming ka fanya mina video to olum nyinti ko mol nyantale ye ko ye song ko nyimu sa salti mi yaron ko abe caring because han sai mo jama bije ka fulo ko nyimman ke sa sati ye political dindu ko kono ka fo mole ko government be coding la and stuff like that dol ba fulo ko ha ne nyin sora jama ne nyin sora kare karang nyin sa sate sawun no loila so
mm.
ntela kuma kan be kela minti pour ka afutandi mola wala nyinti ko nyimu sa salati mi yalon ko abe sotorine ñimi sasalte mi yalon ko abe janjan kan Gambia le andun asembo bo warala baba kele fango amanke ko man la finna banko la nkanna ba mbankanna banko le salalu manna banko salalu ku it is something that is going to happen and mol be nyanto wolon nale then government ye fenkol min put in place protection measures or min put in place wala min ko social gathering mol nyantale ya bula katara nyokan nyantale nga wo bula nin tabula la fana nyin na tra nyin mukulete mi yaran ko tabula la no for example kata mariseto because tabula no mole ko alkata mariseto molle da yin ngolla babal lolu won da yin ngolla babal na bi ta mariseto ali alfan protect ibe fan protect no le nyaadi la ye mas dum andu marse fana to mol ka nyuku nyokanne that is something that mol nyanta mindful la ye jamfanyo la demanding the recommendation is 6 feet meaning simfa woro right 6 feet mol nyanta jamfala nyola 6 feet so nyimu kulete mi yalon ko mol nyanta le ya kata ya kata bake ka wo kuol noma aning jamang dulal to fanang mul ba falo ko foyete la salola because they are thinking that misil mola kantar lam folo nyanta kala duality yes wo dual be sa keno le mol sita salola but nal ta saldula mol nyanta le jam fanyola anim fanang hani be jam fala nyola fanang isa mas fanang la fa kan ami ko isa mas fanang dung inayeta modul ba ka fonte ko koy mam mas dung gambia mas mo ta fono la koy mam mas to because hani man tubabo la nyim mas to you can make your own mas is a fundo fan karanole yake masi o hani ma karano isa kuntuno kuntunyabe kuntunyato hani tiko fan yata ya murmure datu motol fanan kono mol katela hajo lella ni mol sa sata mol ka bula motol kono o dol fan moto kono wol fan sa covid so nole mi yalan ko ita mari fan sa ita alon na so those kind of things ni bula la moto kono e bedula dawo da mi yalan ko ita amin ko ita mari da ma kun kilon ta tarla noje e nyantale maske ni ma amin iya maske anin fana ni sa jamfano nal sa jamfano nyola dal ali jamfa nyola so nte fe wolbe kala um scientifically wala mukute mi yalonko abenyun kuranga toro do yandela.
Yeah, Yakuba, I will give you opportunity to comment on what Binta said before my next question to you. I want to use this opportunity to add to Binta. Binta kaminu for wolomu na yum fudu sitolu tala in fact luale biye mi alon ka a mall stop sign from doing those kind of things ye be ban le ni ngabe kala fanan specific number le biya I think 10 na tambito wala 5,000. So sign the onus is on the communities. Yeah, make sure you collaborate with the local security service to make sure we enforce. Because as been time info among ke kon kan na bankole salal whatever, ja okay, but this is the reality. Kurango bijele nga ridle mfango la satele kono number sunyol mini ya soto yo number wo mu tip of the iceberg let because janni wol kasa sa fo mol kol wole modol soundile sate kono je so abole nyama yo na boda je bindama mim mention sa mbele tulo dalto la fo ngamwe hani Gambia fana bole nyama buluko hani sai wato ata important tale mo bidangol min ye mole taps nyol ke bala sign ne fango important mo be nyanto so dole akordada to le ni mol dunta janni kana ni mol society e bulo ku fay janku ni woti je ni alcohol based hand sanitizers is so use ani natan jikita ko sai mo be nyanta face mask sotola yo face mask ngai ko sugute ke bi ka henda no bari kamine ke tol ke nungo janne sit ika face mask sel ay tol ka siti no le ka wonne bi ka henda no e ka fe nan ne fojang ya jele ni afe na mfela nungola bridge oto ja ya city ibe henda la nole ya mo ndola do ko nkaine dun sanji mo ante ba dunna Yakuba maybe min siato ta ba dunna fele jan kuman kala so na tan nunga akamo henda bale abika city kula la samba falla nungola bridge oto ja ya city ba ni ya city la jang it henda la no definitely for kando do Gambia be kandene we can understand that but mimbe kando nin saya walla katela loptano to for certain time it will lala no so Yakuba semina na no kam but next ni boto to lafte deal with min sango siata so kono bakle sign you know people are dying and some of them they are COVID suspected molfanka suspect ika Red Cross le koli kana yo ba dole ka insist ye tari ya bade janning Red Cross kana wala alko kalam tese mu yamar le dinot but before if you have any comment kala bintala fenko ka.
Yeah, Binta was really important. Government responsibility.
Yo, it seems we lost Yakuba. I believe he'll come. Oh, maybe Nawek. Nawek did a trick on you there, right? Hello, Yakuba, you are mute. We can't hear you. Can you hear me? Yakuba, lo volume utadala. Your volume is gone. Can you hear me? Okay. Binta. Yakuba la volume utadala. So ngayon question o milandi tenting. Saya wo kanale anu modol ka suspect ko ila mol min fati bulu COVID le fenke. Yakuba, can you hear me?
No. No.
No, ala voice on yintata.
Yeah.
Okay, that's good. So, what will you advise? Mbenyin time o min kono symptom ol fo e ne woje mola. Fara na ta ka sato soto. Inyanta mine kela.
Well, first of all, I think the government has to implement inganta kule kela mini yalon ko inganta kule implement la mini yalon ko tefe abalabanna. Number one is this quarantining of people, taking them to the hotels and trying to quarantine them. To me, atalabanna. So they need to find out other means of quarantining people or quarantining people. And Kafoko Red Cross ye mulu fanambade nte, I don't know whether that will be something that is sustainable. Red Cross and Mulbade no combo mafangola when it comes to Bolonkono. And also the number of people dying daily in the Gambia now, the way it is going, even though we know whether they are coronavirus or they are not coronavirus. I mean, to me, that's not something that it can continue to be done. So Ntefe, the local government, or not the local government, but the ministries need to come and meet with the local people. For example, in our Burfoot, they meet with the Burfoot VDC, Yeta Sabiji, Yeta Sukuta, the same way, and and meet with the local people and try to teach them how to bury their people. Because right now, ni more fathers work on, you don't even know whether it's COVID or not COVID. So, how can you say that? There is no way for us to say that this passing, that was due to COVID or not. But near general principle or the mola is something specific gi mole ka fo ni momo fata ni watin kono bari be pandemic watu lo kono nyanda ka bari ten. I think that would be better for us to do as a country than asking for Red Cross to do. Hello? Uh-oh. What happened?
Hello, yes, yes.
Oh,
Hello.
okay.
Yeah, no, no, no.
And in the one at the
Until
side.
we meet, yeah.
Oh,
Name
okay.
Yankuba, so continue. Yeah, we lost you a
I'm
little bit.
really sorry. This is just epileptic in system on your Tala can I know. So
No problem. It's
yeah.
the new technology. Ntolbe ulutale before this technology, so we have to live with that.
Well, right.
No problem.
So go
Born before
important
social
point.
media.
What I was trying to say, government responsibility, we the community responsibility on this. We should stop pointing fingers at the government, and the government should stop pointing fingers at the community. We are in this together. Government our responsibility of preventing infection, protecting the population, and trying to control the community. Unless this thing is not going to work, because in no time all the resources available almost can all be used to compare it. So community la part meaning la Binta will be in stress now, where it's unavoidable and a social distance. But if you look at most families, setups are such that marché total you take it by force, because nobody has tomorrow's food at home, and somebody has to look for that money. So me borrow money, obviously it's allowed to go out. Maybe that marché organize allowed to go out, but I'm not cutting the family do. They are not going out to get money or to work or to cook. Not trying all contains work on a woman found la responsibility. But near you sign didn't want to farim but everywhere. Had the sign if I'm having a new video club, they are still working. Video club, that's the perfect place for COVID-19 spread, But people are still doing it because of this from coffee up to 10 o'clock. 10 o'clock, which in my opinion is useless, because you'll have to move in the yakele before 10. Video club, they are open, they can close before 10. But how much spread goes on in those places? Is I think it's a faulty way of imposing a curfew. The population they know who needs to go out, who can go out, and when they go out, how do they behave outside? We don't sit down, government pointing fingers, people pointing fingers at the government. It's not going to help any of us. I hope that's clear.
Yeah, that's very, very clear, Yako. You mentioned something very, very important. I never even sit and think, wow, the video clubs are still operating.
Absolutely.
Wow, wow, wow. That's what they call is one of the super spreading venues, like super
Absolutely,
spreaders,
yeah.
like the scientists are trying to explain. But the super spreading venues are the football stadium and these kind of confined, spaces, poorly ventilated. I've been to some video clubs in the Gambia. During March you could hardly breathe. Could you imagine if you have one positive somebody there shouting at the top
Absolutely.
of his voice? That will be a disaster. I think that's what is happening. So, Binta, still, I'm going back to the bubble, but this one I'm going to start with Yakuba. Yes, this is a fact and it really worried me. Now, you said this bubble is inevitable, is going to burst, if not burst already. Do you think Gambia need to go for international intervention right now, or we can deal with this?
You don't need rocket science to know that.
Yeah.
How are we going to be able to deal with this? Where a setup is, Combo has the only referral hospital. Down the country in Bansa, you have the second one. I don't know how many ITU spaces are in any of those hospitals. Even if we do have the ITU spaces, thanks to COVID, ITU of 15 people will now take like 6. So Binta Bologamba no ITU, maybe I think we had 4 beds. Obviously, that room will not even cater for one ITU, one COVID patient at the minute, because all the precautions you need for COVID.
Mm-hmm.
And I understand, because I got this from clear sources. Gambians are now going for people are aching to go for ventilators. I'm telling you, for this at this moment in time, we should not even be thinking about ventilation. This is not to say Nyanta Molbala is the cruel thing, is the most cruel
Mm-hmm.
thing to say. But Kavoka ventilator star in a health system like Gambia, Nungesan is a bloody waste of our money. Sorry to say that word. It's a waste of our money. Nungesan sign ventilators. Ventilators are like, to ventilate one person, that will take enough money to protect 2,000 people. I don't know if you are with me, because even to intubate, which means kachubo ta kabula mo kan kon puro ya connect machine ya ma ko handle. Wo act from the ma, you need no less than 4 people doing that. Near tube of an kan kon ya connect machine bar. You need somebody sitting there 24/7, changing things, changing dials, changing the gas flow, and all those things. And intubation, ventilation, is not just a doctor's work. Nurse like found a document, and these nurses have to be highly specialized. I don't know for would be Yalaba. Meaning they are highly specialized for ITU, intensive care, or critical care. So ventilator school former at this in the middle of a pandemic, I think it's a no. Money and Amira found, apart from the cost, my human resources resource based again. That's what I would say. So ventilators or ventilating people is completely out of it. Sad to say.
Yeah, so Yankuba, you saying economically it's not sensible, because I had up to one ventilator could cost up to 45,000 US dollars. But that's one part of it. But manning it, you need
Manning
the
it.
manpower. You
Yeah.
know, the number of trained specialized staff a ventilator need, it's with like a white elephant, just as you mentioned with the new ambulances we have. You know, you mentioned just the ambulances. We need some respiratory therapists specialized,
I,
to do the,
I, I, I
airway.
think if that might be a topic of its own, a day of its own. I
Yeah.
don't understand the logic of those very equipped, very expensive ambulances. If they are bought for COVID, I don't know why they were bought. One, if look, I had a look in one of them, a picture of it. Obviously, I wouldn't say I had a look, but this is a complete ITU kind of ambulance. There was facility for airway, there was oxygen, there was ECG monitoring, there was everything. The last time I know, Gambia, we did have drivers in the ambulances, but we did not have airway skilled individuals in those ambulances. They were manned by drivers. So how are we going to teach people on airway? How are we going to teach people on looking after critically ill people in the back of an ambulance? So I don't know why we bought them. I clearly
Yeah.
don't know.
Thank you. I have to mention that because it's an example you mentioned to me earlier. Binta,
Mm-hmm.
doctor ofela ko Gambia mansula ventilator la sai mol ba fla yin doctor o do bodam do sa barite I understand, I believe why Yakuba yofo fesa
Yes,
fono mande ga kan la mina tin nan tol nyanda nyatil na kudo la bar ventilator nga jenke why.
because Yankuba e min fo abo wole
Mm.
nyama ventilator pour que ventilator manage hani US jang ventilator one day to manage ventilator one day is like jang dollar ko do wuli say per bed.
You
So
joking.
Yeah,
It
ventilator.
really
Yeah,
helps.
Wow.
yeah,
It
ventilator.
surely helps.
Yeah, ventilate. Having patients in ICU is. I mean, kind of expensive tobacco. You have to have a
Mm,
doctor on the site all the time.
mm,
You have to, because I used to work in the neuro ICU, so you have to have doctors on the site all the time. As a nurse, you need somebody. Nurses are there all the time to monitor all those numbers, to monitor the patient, but at any minute, if you need a doctor has to be there, because these patients can change anytime, anyhow. So that's how critical their conditions are when they are on ventilator, and not even on only ventilator, they are on all kinds of drips, all kinds of medications that are also going on. So a patient to take care on a ventilator is not an easy thing to do. I don't think even Gambia has ventilators. I don't think they are equipped. We have enough resources and manpower to take care of patients on them. So I think Yankuba coming for instead of spending money on those high tech equipment, mini along with na faso tala, I agree with that. Instead of spending money on all these expensive ambulances or ventilators, neo kodota neo resource ta, instead of talantala nyo tema per diem, I don't know what they call it, whatever extra money they have. I think they need to use that money or that resource and pump it into the community, because new COVID-19 prevention, it requires a whole lot of community education and community involvement. So um, I think government needs to pay more attention to that than going into focus lower than focusing on buying resources like ventilators and stuff. I mean, oxygen, I had come like Molmbe Gambia ka fanyaming, oxygen is very, very limited. And ntefe having an oxygen or fungus to wala funga ifisangata ventilator. It's not like I'm trying to kill people come yankuba yak fanyaming, but it's the fact. Yeah.
Yeah, thank you very much. It's about being realistic.
Yeah.
Right now, it might be preventive measures. Nyanta concentrate la wale come back and this high tech. Me along, we don't even have the personalities to man them. Just near your land ambulance school nata is well equipped ambulances. Everything in it. But who is going to man them? I was a witness to this kind of scenario last year when I went to the Gambia. Before I even arrived home, I found a hit and run victim on the road. But when the ambulance man came, eventually he came with a pair of gloves and just a stretcher. So even me helping him, my blood, my hand was stuck with blood just to help him to load the guy onto the ambulance. So yeah, I think this is very very important topic, and I hope somebody out there is listening that let us invest that money in preventive measures, and also maybe isolating the COVID patient from the others. And the other thing also Yakuba mentioned was this pandemic, that we need intervention, outside intervention, because right now I don't know how we're going to get out of this, because there is nothing in place. We have lot of opportunity. Allah give us lot of opportunity. We watch Europe, suffer tremendously. We watch America, we watch Senegal and other countries, yet we don't put anything in place. So when these things comes now, we need all those um, um, there is nothing to solve for it. So yeah, where do you think we can call them, like Red Cross or International Red Cross or Senegal, or where do you think we can call on this help?
Mr. Manjan, that's a difficult question. Mandinko from coming from Cote d'Ivoire and Julo Kolonkon.
I
Every
know,
country has
yeah,
its own problem.
Mm-hmm.
I know.
Mobile blow of foreign. It a Red Cross being called Red Cross, like international donors or butter dime. They are struggling like anybody else.
Yeah.
I think we have to come up with lots of indigenous ways. Putting on farm market. Banco
Mm-hmm.
Bela awareness is very important. But attitude mean at this point is wrong. You understand? Ninga mira ko mole binala nyimbon lankang moment I'm bon lankang. You know, that's the sad truth. You know, moment I'm bondanka. Mpong la nyanta sila nga responsible behavior okay. Moli si family soli si nga diamu nga fonyo who should go out, when they should go out, what they should go out for. Because intaba finta bantala. I maybe COVID tenta fala. But intending COVID didn't na suwala kono. Njit nimbale ta contacts to me ba sembafa. So nungamba that's blood on my hand. O hani banti hani scenario nyu manke mbati intending COVID that lalo to modo infect ngamanta te fala ita modo la fa near a long time ago mol ba fala ko COVID man sembo South Africa buka mol fa Africa back. Look at it saying if you amo sorry nka for amo all the time na population dynamics jibe
I like my amo name though, no
we
problem.
have a young population. We have a young population. COVID dunka kebal lefa. You understand? Why ita imagine no control death rate nyanta dual mi yanko ila population is skewed. Mi yanko kebal siato ko didon siato nyami. So ibadel because aka kebal lefa kebal man sian toli ako kebal siato banko lado to nyami. Ndol ko use ka ko hantol mo fi ngol mbamban talewati no COVID buka ma no. COVID la victims sol man sia ya. Isiato da ma ko le fa ba ki man sian toli abaka na buka fa ba but young person to the COVID can be do far and until I say I did say about far can already. Yeah, understand. I think you know about this. COVID starter, modular attitude, even intellectuals, even people who are high there with epidemiologists. You talk about when the pandemic starts, yeah. Aita more be far now will be far. You understand? Naturally, it will go up to the top. It will plateau. Then I'll because all the susceptible people are gone. But saying COVID abe evolve kanyami mola ajel ko fa manta kire to nyati aka modo mala na amari ma koteng aka dol fa ma he leaves them with permanent paralysis. Permanent paralysis mean aka lanjuro tu ibale inel buka recover no wala. So kurang mi matiti muna nente sila la ngamabo. You understand? Ni manke an fangol kamanga ke na mol kamanga in infect. But kasi ka ko ha nim pare han to bawole vaccine boni bina dila na o mol bina mako jeni to vaccine sola baba to bawole if am be supply fo be asoto de son tolma asoto fo ntolnga lonko ni mum fon la responsibility kasi ko no attitude ka ko mol bina mako la water internet mo be blow farin so far.
Yeah, thank you very much. And that's honest and frank to the point. This is the final segment. Binta, now that Gambians are not even going to the hospital for fear that they might be considered positive COVID and they will be sent to quarantine, the stigma. Gambians are not going to hospital and they are managing their illness at home. What advice can you give to Gambians right now?
Well, some people are going to the hospital and the hospital healthcare workers are running away from them. That's another scenario that is going on around there. Because I
Wow.
talked to somebody in Sibanor. Yeah, one of my friends is a nurse in Sibanor Hospital. There is this lady that came from Brikama to Sibanor to another, is it Buyam, another hospital. They end up sending the patient back. So the patient was just coughing and respiratory distress. So Brikama went to Brikama. They say Brikama people say, they cannot admit the patient. So something like that is going on. So come Dr. Sanneh afanyaming yala mulka afolo nunko
Binta, can I interject?
Yes.
Can you expand on that specific point? This patient is going from Brikama to Sibano and that.
Yes.
And very likely she was using a public transport. If that patient happened to be COVID positive, very likely, even if he's using private, somebody is going to drive him.
The patient is actually COVID positive. The patient, to my knowledge, the patient is COVID positive. So the patient starts to have respiratory distress. The patient went to onyintata ni yolo koliata bula ni fengol patient onyintata Brikama. Eko Brikama healthcare workers so wolka borala. So labang mo kilinata findi ka fa ko han tolbuka COVID patient tol tajang ye 1025 call wolme danku. Nobody is there. Then ngamro ma fong le geba ma amin ko gebe man ko man dula soto no they went all the way to Sibano. Sibanol fana ngamre wol fana yela karakilingo sorane or something like that. It's not even government clinic, it's some private clinic there. So wol fana ya patient on you refer to BM. But the patient end up coming back to Banjul, but it took, like couple of days before that will happen. So those kind of things are going on in the Gambia. So it's not only like people are scared to go to the hospital. Yeah. So just purunga kumanding fai Dr. Sanela kumo kan yalo mulka fulo ko Gambia mulka fulo ko Africa mulka fulo ko nyin sa sabu kan mofingo ma ndola America jan sign those who are working in amini yalan ko ba ICU do kula nyin COVID ka min fanke mofingo la anin Spanish wala nyin COVID biko woke tubabola because morphine jama bije they have so many underlying diseases kuran jama le morphine jama le min yalon ko bikata loptano to Gambia o sifa le bije diabetic be mo le malon high blood pressure yele siya be le malon anun kuran jama bije malon. So morphine seems to have the same behavior or similar behavior from Africa to here. So ntol morphine killing wala min fana bijang they have similar behavior. So wasifa al katarela so ni nyun kuran dunte balo kono kake kutilale andi tol jama itol la fanka fan tol la janyi watin kono so ndewa min fola Gambia no wala min yinti ko nyimmu kulante de mi yalon ko amanke amen ka amanke ko kaka tubabul da mala muta nyun kuran ka mofingol mutale anda ka jawya mofingol tole naye muta so mobe ka wajibi yata momo la kan Gambia banko kan puriye fan protect and yela mol fanam protect Dr. Sanneh ya fanyaming dindingolu jama buko kuke dindingol la but older people like 40 years 50 years 60 years kaka wolle batandi so dindi te tatela for video club poto lombang o itatela kulidula inate te covid so to covid nyimmeta batandi hani fengi ma wo so to ni nate yadi ba mala o yadi la nebola yalo wo amen nuwol nata fa akuo kono ko amen kasta keta mari fongo junuboti or something so that's why it's very very important konyu amen ka wajibi yata mobile kam puriye nying puriye fan tankandi nyin sasala so that kwesa order mol tankandala because mandin kol ka fa nyamin bade kafanya fu bade la kadang dinkadal to something like that governments are for no mole ko alkata nyun dula kari governments are all these frankly impose mulkang but yet it's left to us to take to take care of those things because government na no ko e mask moda to gunjuru government itala sabi je mask moda to bufu fana the same thing so ngamra mol ndo min fola mol wala nyinte ko mol nyantale nyin sa samu da seriously mol nyantale ye fang protect mol nyantale yela alfal protect yela sate protect yela banko protect.
Yeah, thank you very much, Binta, and also thank you very much. And I believe Gunjur TV Online will really appreciate your today presence. Yankuba, we're going to close this program, but before then, to elaborate on what Binta said, Gambia, our comorbidities include Kinikuma Domo. If you are not properly fed, know that you are susceptible to any kind of viral infection, much more COVID. Binda mentioned about diabetes, hypertension. These are very common within the Black and Asian communities. Why? Because they are more likely not to visit their GPs, especially places like US, Mia Lonko, insurance, and Infenko, Bontola healthcare system, ole fongotiji. So, Ninka Tarelele Ibika long. And na Gunyur Youth for Health, past 3 years, they go around like molla blood sugar test yani la blood pressure ika like bini tada gunjure tala order sobab to sifo and they keep records. So this record they put it together up to 189 people, they send it to me ngadi na statistician wala jang I analyze. And what he found is just startling, unbelievable. Like 68% of that 189 are pre-diabetics. Like the blood sugar, fasting blood sugar is between 5.6 to 6.9. So many alonko, they are already diabetes, about 47% of 189. Yo, nana hypertension will stay elevated. Many along ila blood pressure is elevated 19%. Stage 1 hypertension 16.4%. Stage 2 41.8%, and hypertensive crisis 8.5. This is in Gunjur. So I can say, maybe this result might be biased because maybe those who feel that they have hypertension or they had it already, they want to confirm if their blood pressure is high or their sugar is high. Those are the people might be motivated to go and test. But this is serious numbers. So if this is the situation in Gunjur, you can almost say rightly the situation in Sukuta or Brufut or Brikama. So that's why our death rates, I'm not surprised. It's one of the worst in the world. It was 1 week ago 1.9. Yesterday it was 2.8. When today's results were announced, I calculated it's 3%. So this is very, very worrying. Binga coming from Molie, Kurang onyinta seriously. Ntola best chance wolo ngamfong tankandala. Na tata fire ngan soro na chance doya battle. Yimu sola ko jiweba. Atata brikama. Imang hani kata or whatever, but you mean from it will be ketafang. I boja ita for jana way more jealous sound. Janning wo tilifulo kono. Could you imagine that? So Yankuba ala baraka is a program on the general advice and also might be something I don't ask you will want to mention in this program.
Amongst ya katawaka, I commend you. A forum on your meeting of control is so good. Gunjur jiko kenak Allah kama Allah la rumano.
Yeah, make credit deal. I was made in Sukuta, so no problem.
Bakari dembo ni mfansu bayala ni wolba kachala. Ibuka le video ala yam.
But ne na furel tofo ka fala mai kafaroni nemo ke kadwe ne furel tofo yeah. No problem. Yes. No problem you must.
Amoyemi potential is very important. Diabetes, hypertension, other chronic illnesses begambenya.
Anin kini kuma domo.
Anin kini kuma domo based on the yes. Because fuaria moma la fi
yeah.
Mobe adama jumbera ta fang tapatola. Kini kuma domo ta dai ma man soto jere. Nga dua alman fuaria baila. But fuaria kurang anin poverty tibabo ulo triad de soto. Fuaria bedam kurang katarol to poverty katarol. You understand? But kurang ni jati kinda nimi yo nyini jama ila kol ka fisianol.
Yeah.
And the work soto dami alimbe na urutiel noma nge noma. Man said la min provided your poor health. Alngata the little facilities that are there alnge use. Gambia near is so sad. No blood pressure in a diabetes or you can treatment start later halfway they stop because resources are not there. They don't have the money to buy these medications. Imagine telling somebody Rami.
Yo, sorry, Dr. Yankuba. Yeah, came.
Hello?
Go ahead. Yes, go up, proceed, yeah.
Hello?
Hello, yes, came. We can hear you clearly.
Hello?
Yes.
Hello, yes. He's not hearing us, so...
Sorry, more
yes.
than call what I call you, no?
Okay.
So,
okay.
My blood pressure problems at all. He start using medication, a la financial status falenta. The next minute he cannot buy the medications. Whoever stop like oral use, but hypertension doesn't know that. The hypertension will continue. Nani hypertension the katin nanka stroke soto, atel katin nanka heart disease soto, atel katin nanka death sentence soto, all kidney failure. Because he like kidney kilo new stock to kadoku okay. Gambia nunku mankeje. Nira si mayata mbita kari fulala wata ala market bala what. So hypertension control or borol mini use man sakunda mol marko wala simple essential drugs Kauls provide at least at a price that is subsidized. More Africa it should be free at a price that is subsidized at least a healthy population or sort of kurang lena mol seminu resist no. Nitata poverty that in the Kumadomo war is the socioeconomic devastation with COVID is way too much. I think Momadua in that, but in Katanyami, Marcel close kang, Mol Minika Kodo provided a family and Dulba Fakang, so if I we are still in the dark. Momang ala the devastator in the limit long follow. But along sitting along dice, there are darker days ahead of us. So Mbaduala Bankoy could be being to our alamakitati. But atake no la nim man tesiti nga do ko ke nim man tesiti ngam fangol sayndi nim man tesiti nga ko ke min nyanta kala mol kamin par kalela moy kudo la min yalan ko is born out of nothing al ngol stop and wosiata yale ninga fo start bi at banna no mol ko bela for reckless attitude mol ko bela for min yanko they are unfounded mol ko bela for min yanko sometimes it's ulterior motive because he took offense to jail so alngol bondi je nga experts o lamoy nga experts o lamoy ko to moko tambino jelato ko ka fisiano jelato ala barka ba kiyam.
Yeah, thank you very much once again, and thank you, Binta. Really
Okay, thank
appreciate
you.
it. Thank you.